A triple health threat in circulation in the Caribbean region, all transmitted by mosquitoes.
Dengue, chikungunya, and Zika viruses are all transmitted via the Aedes aegypti and Aedes albopictus mosquitoes. They are presently co-circulating in the Caribbean region, so it is important that we recognize the early signs and symptoms.
Early symptoms of these illnesses include fever, headaches, and flu-like body aches, but each virus presents a unique threat to the human body. Internal medicine specialist Gloria Girard explains that chikungunya, which has a 3 to 7 day incubation period, can manifest with joint pain, morning sickness, and a maculopapular rash in those infected.
Severe complications, including meningoencephalitis, which is inflammation and/or infection of brain tissue and the membranes covering the brain, cardiopulmonary decompensation, which is the inability of the heart and lungs to maintain adequate circulation and function, acute kidney failure, and death have been described with greater frequency among patients older than 65 years and those with underlying chronic medical problems.
Girard explains that certain individuals are more susceptible to the severe forms of the mosquito-borne illness, as in the case with pregnant women and the Zika virus.
The Zika virus is associated with Guillain-Barré syndrome, and pregnant women are also at risk since it is associated with congenital microcephaly and fetal loss.
The last virus in the triad, dengue, comes in 3 categories of symptomatic infection. 1. Dengue fever, 2. Dengue hemorrhagic fever, and 3. Dengue shock syndrome, which is a combination of hemorrhagic fever and plasma leakage that can lead to circulatory collapse and shock.
Plasma leakage is the process in which the protein-rich fluid component of the blood leaks from blood vessels into the surrounding tissue. It is the most serious complication that distinguishes dengue shock syndrome from dengue fever. Signs of plasma leakage include fluid buildup in the lungs and abdominal cavity. Persons may have a weak pulse, very low blood pressure with cold and clammy skin, and restlessness.
The internal medicine specialist advises individuals infected with the dengue virus to avoid aspirin and steroidal anti-inflammatory drugs like ibuprofen, Advil, Aleve, Voltaren, or Celebrex, as these can increase the risk of bleeding complications. Instead, she recommends using paracetamol or acetaminophen, such as Panadol or Tylenol. Additionally, she emphasizes the importance of established protocols to stave off the mosquito-borne diseases.
By taking personal preventive measures to avoid mosquito bites, like placing screens on windows and doors to prevent mosquitoes from entering the house, the use of mosquito nets, mosquito repellents, and wearing clothing that reduces the amount of exposed skin.
The Ministry of Health has called on the public to proactively discard, clean, and cover containers that collect standing water around their homes, aiming to eliminate mosquito breeding grounds and combat the triple health threat posed by these pesky insects. Sola Alfred, HTS News Force.